Do you or someone you know have joint pain and think the pain is influenced by the weather? Does the weather really influence joint pain, or is it some other factor?
We are interested in this topic because one of us, after injuring her knee, now experiences weather-associated pain. Or does she?
First, let's go over how a joint works and how a normal healthy joint compares to a problem joint. In an undamaged joint, the cartilage contains a high amount of fluid which provides a frictionless surface and allows for smooth joint movement. The hyaluronic acid secreted by synoviocytes in the synovial fluid helps reduce friction, lubricate the joints, and absorb shock. The synovial membrane keeps synovial fluid in and blood out.
But in arthritic joints, both the synovial membrane and the synovial fluid have thinned. The synovial fluid can't keep the cartilage lubricated, so it can't glide as smoothly. This leads to erosion, which then leads to bone exposure. Hyaluronic acid leaks out of, and blood leaks into, the synovial membrane, bringing with it inflammatory cells that drive further degradation.
Early on, there was little agreement as to whether or not joint pain was affected by weather changes. Now there's a general consensus that weather does influence joint pain. However, no one can agree what weather changes like temperature, humidity, and pressure, nor the internal mechanisms. According to a study performed by Smetsland and colleagues, generally, weather influenced pain and arthritis, but they did not state what changes in weather are the factors. Another study will expand this to include stiff back. They suggest that dry, stable climates would be best for those who experience stiff backs. They also didn't specify what changes in weather might precipitate symptom aggravation.
But in a paper done by Gedge and Weinberger, they cited earlier studies from the 50s and 60s that claimed people with rheumatoid arthritis showed improvement in a warm and dry room, but point out that pressure was not controlled for. Another study they cited stated that an increase in humidity and a decrease in pressure caused more pain. But according to their own study, increases in pressure and temperature concurrently caused increased pain. This clearly differs from the other studies.
Fergus and others, though, found instead that a decrease in pressure and a decrease in temperature caused increased pain. To further complicate matters, McAllen et al. Found a decrease in temperature caused more pain, as well as an increase in pressure. They also suggested that it may be fluctuations in pressure, as opposed to only drops or elevations that cause pain.
Yet another study simply associated humidity and cold with increased pain. Aikman also found that higher humidity and lower temperature caused more pain, corroborating the previous study. And then we have the studies that simply associate general seasons with an increase or decrease in pain. Ikuni and company found that participants in a survey associated spring with more pain and fall with less pain.
A 2010 study found opposing results. Instead, they found associations between warm months and warm sunny days and less pain, and cold months with more pain.
This is because warm months are typically associated with more activity, which improves joint health.
There is only one paper we found that claimed there was no association whatsoever. They used self-report from the participants but found no statistical significance between weather conditions and arthritis pain. They believe it is psychosomatic.
Researchers disagree about what the weather does to affect pain as much as they disagree on how. A few different mechanisms have been proposed, all very different from each other. One such theory is that mechanoreceptors in damaged joints could be irritated after a decrease in pressure. Yet another theory presented in the same paper suggests that different tissues, like bone and muscle, are different densities and therefore have different degrees of change in pain at trauma sites. Mood might also influence pain by affecting pain perception.
Another paper suggested two more possibilities. One, that change in weather increases stiffness, which increases the pain response. Additionally, they thought change in atmospheric pressure could cause a pressure imbalance in the body, increasing pain in joints.
All of these studies contained some form of survey or self-report, yet they all came up with different conclusions. Rarely did any two studies have similar findings. We believe that just performing surveys is insufficient to determine to what extent weather affects problem joints. We think that if researchers are going to continue to study this, someone needs to perform a controlled experiment similar to the one cited by Gedge and Weinberger, and should include subjects in varying environments as well as in different stabilized environments. While this would not necessarily accurately portray real life, it would be a step towards a more definitive answer.
After considering all the studies we found, I believe weather does have some influence in inflammation of arthritic and injured joints. However, I also think it is most likely a combination of both weather and non-weather related components rather than just one specific factor, and each person may have a slightly different combination that gives them varying degrees of discomfort in the joints.
It's difficult to determine the extent to which weather may or may not play a role in joint pain. As many of the papers stated, there is likely a varied and personal response, which seems to be a recurring theme in environmental physiology. I personally believe that there is a weather component influencing my knee pain, and for me it's typically when there is a drastic drop in temperature, and occasionally before major rainstorms. I don't know what is going on inside my knee, but I know it hurts.